Hi once again. In this video, we'll be looking at how to do a stepwise approach in a patient assessment trauma victim. So we're looking at how to do a step-by-step trauma patient assessment. First, in the trauma patient assessment sheet, you need to look at 5 major things. And we'll be doing it in 2 different videos. In this video, we're tackling the scene size up, the initial assessment or the primary assessment, the history taking, and then the vital signs. So to begin with, firstly, scene size up. Now, scene size up, we have 6 things under scene size up. First, your BSI precaution, which means the body substance isolation, which basically talks about your gloves, your eye protection, your full gown, depending on the situation at hand. So after your body substance isolation, which is the BSI, you move to the scene safety. Scene safety is very, very paramount and is very, very important. Before you provide a care to the sick or injured victim, you need to make sure the scene is safe. So you need to make sure you check for any possible hazard that could harm you, the rescuer. So you assess for scene safety, and you need to ask yourself, is the scene safe? If the scene is safe, then you can go on with your assessment process. If the scene is not safe, can you make it safe? If you can't, do so before you get to your patient. If you can't, if it's a fire scene, make sure you call for the fire service to make sure they pronounce the scene safe before you proceed with your patient assessment process. After you determine for scene safety, the next thing to do is to check for the mechanism of injury or nature of illness. In this scenario, we'll be taking a scenario of an approximately 30-year-old male who sustained a GSW, which is a gunshot wound to the left upper chest, and also sustained a deformity at the left lower leg. We are talking of the left tibia and fibula. Now, so for this very video, we are looking at the mechanism of injury. Now, mechanism of injury basically talks about the force at which this injury happened. Now, basically, mechanism of injury also talks about the reason you were called. So you were called for a gunshot wound. So the mechanism of injury of this particular patient is a GSW, gunshot wound. The next one is to determine the number of patients or victims around. So in this particular scenario, we have 1 victim available. Then request for additional support when necessary. You are requesting for additional support when the scene is not safe, or when you have multiple casualties to request for more EMS support, or when there is a crime scene and you want to call for the police support. The next thing is to consider C-spine stabilization when necessary. So since the victim over here is a trauma victim, you need to suspect a C-spine injury. So I'll direct my partner to do a manual stabilization of the head and neck and maintain that till we complete the patient assessment and the patient is fully immobilized on the spine board. So for the purpose of demonstration, I'll do that. So you first come to this patient's head and then stabilize it this way. You make sure you stabilize the head and neck so you mobilize the patient fully onto the spine board. So let's assume my partner is stabilizing the head and neck. Then the next thing to move on is the initial assessment or the primary survey or the initial survey. Now the initial assessment comprises of 7 things under it. The first thing is to form a general impression. So the general impression basically will talk about the patient's age, the patient's sex, the patient's position, and the patient presenting injuries. So my general impression of this particular patient is about a 30-year-old male who sustained a gunshot wound to the left upper chest and also a deformity to the left tibia and fibula, lying in the supine position. So that's how we form a general impression. The next step under the initial assessment, after forming a general impression, is to determine the level of consciousness of the patient. So in determining the level of consciousness, you first check whether the patient is alert. So you use the acronym AVPU. A for alert, V for verbal response, P for painful response, and then U unresponsive, meaning the patient do not respond to your voice as well as the painful stimuli you apply to the victim. So now as you approach the patient is not alert. So you need to talk to the patient. Hello sir, the patient is not responding to your voice. So you now need to what? Inflict pain on the patient by either tapping on the shoulder or inflicting pain on him or her to establish that the patient is what? Unresponsive. If the patient do not respond to your painful stimuli you are applying on him or her, then the patient is unresponsive. Now you need to, the next step after determining the level of consciousness is to determine the chief complaint or apparent life threat. Since the victim over here is unresponsive, then you need to get the apparent life threat to the victim because the patient is not responsive. If the patient is responsive, you're able to get a chief complaint of the patient. Chief complaint basically talks about what the patient tells you, what the patient feels, and basically it's about the reason why the EMS personnel were called. So since the patient is unresponsive, you need to determine any threat to life to the patient. So you expose the patient and then you check for any injuries that compromise airway, breathing, and then circulation. So you check whether there is airway problem and you give management to that. You expose the chest. So now per the scenario we were talking about a gunshot wound, GSW. So there is an open chest wound. So what you do is to make sure you seal the open chest wound with a three-sided occlusive dressing. So that means you close the wound and then you seal only 3 sides. Now with all open chest wound, there's a possibility of a pneumothorax or a tension pneumothorax. And the reason behind doing the occlusive dressing is to make sure air do not escape into the person's thorax, but rather make sure air rather move out from the thorax to prevent any possible tension pneumothorax. Then you move on to the other body system, checking for any major bleeding, and you make sure you control all major bleeding you identify on the patient. When you are finished with identifying life threat of the victim, then you are now going to assess the patient's airway. Now since it's a trauma victim, we use what we call the jaw thrust. If it's a medical victim, you use what we call the head tilt chin lift. So since for the purpose of this particular video, we're having a trauma victim, we do the jaw thrust. So with my imaginary second rescuer holding the patient's head and neck in the neutral inline position, we just open the patient's jaw thrust. So for demonstration, you put your arm this way and then you thrust the jaw. So you thrust the jaw upwards to open the airway, and then you check for any airway compromise. And in assessing the airway, one, you open the airway using the jaw thrust maneuver. You check whether they are broken teeth, and if there are secretions, you suction. After you suction, you insert airway adjunct when necessary. So for instance, you first start with your oropharyngeal airway, and we have the nasopharyngeal airway. With the oropharyngeal airway, you measure from the corner of the mouth to the tip. So you measure from the corner of the mouth to the tip of the earlobe. Or with the nasopharyngeal airway, before you insert, you make sure you apply a water-based lubricant before you insert it to the nostril. When you are done with the airway, the next thing to do is to assess the patient's breathing. So you are checking for breathing rates, rhythm, and then quality. So you are checking for the patient breathing. Is the breathing okay? Normal breathing. You are checking whether the chest rise normally, and you check for the rate. Normally, for a patient to breathe in the normal rate, you are looking about 12 to 20 breaths per minute. You also look at the quality, making sure there is equal rise and fall of the chest, and then you also check whether your chest still is good in place. Then you check for the pulse. In the pulse, which is for assessing for circulation, since the patient is unresponsive or conscious, you check for carotid pulse at the neck. So in carotid pulse, you get your index finger and then your middle finger. Place it at the patient's Adam's apple. Slide it about 2 centimeters either to the left or right side, and then you pause. Press it a little bit further, and then you are checking it for about 5 seconds and not more than 10 seconds. So at the Adam's apple, you slide it about 2 centimeters, you pause, and then you press it a little bit further, and you check it for 5 seconds and not more than 10 seconds. If there is no pause, then you need to quickly commence cardiopulmonary resuscitation. So at this stage, there is a pause. Then you check for skin color and condition. So you are looking whether the patient is pale or pink. You also look whether the patient is wet, cool or clammy. So if the patient is cool or clammy, there is a sign of the patient having a possible shock. So you manage the shock as that. Then you also look for any possible major bleeding, and then you control the bleeding. Also make sure if there's a compromise to breathing, you give the patient high concentration of oxygen at 100% via either the non-rebreather or through the bag valve mask, the BVM. Now, there are precautions in applying either a non-rebreather or a bag valve mask. Now, if the patient is breathing from 8 to 28 cycles per minute, then you can give through the non-rebreather. But if the patient is breathing above 28 cycles per minute or below 8 cycles per minute, then you use the BVM to provide a positive pressure ventilation to the victim. Now, after assessing for circulation, then you look for priority for transport based on your GCS. GCS means Glasgow Coma score or scale. Now, the GCS talks about 3 major things. 1, eye opening, 2, verbal response, and then 3, motor response. The highest score or the good score under the GCS is 15. And then the lowest score or the minimum score is 3/15. So 3 meaning that under the eye opening, the patient do not respond to any eye opening, so you score 1. Verbal response, the patient do not respond to any verbal stimuli, so you score the person 1 at that position. And then motor response, the patient do not make any motor response, so you score the patient 1, and all the patient scores 3. So in this, my patient, the patient scored 3/15. So this patient is a high priority for transport. The next thing to do is to gather the history and then your baseline vital signs. So now you gather the history, make sure you ask whether the patient is having, you ask by bystanders or any relation to the victim, gathering whether the patient is having any history of medical illness, whether the patient have gone through any surgery, so that when you are handing over to the receiving trauma center, you provide them those important vital information. Then you get your baseline vitals. Remember, when you are assessing for breathing and circulation, you check for your respiratory rate and then the pulse rate. But remember, you also in their baseline vital signs, you need to also check them as well. So in the baseline vital signs, basically you are looking at the BP, the blood pressure of the patient. You also check for the pulse. You also check for the breathing, the respiratory rate of the patient. You also check for temperature. You also check for oxygen saturation of the patient. And then the last thing, which is also very, very important, is to assess the pupil. And the pupil is using the acronym PERL, P-U-R-R-L. Pupil equality, roundness, and reactivity to light. So you make sure you check for the blood pressure. So you get your sphig. So you are going to check. When you are done, you also check for the patient pulse rate and quality. You also check for respiratory rate and quality, and also make sure the oxygen you are providing to the victim is really helping the victim. This is where we pause for the part 1 of the patient assessment process. Thank you very much.